This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Well, if you're headed out today, we suggest one thing: bundle up.
Yeah, it's cold.
Bundle up. But we'll keep you warm here on the radio. Health Watch is the program every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. I'm John DeMasi with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And as always, we tell you that we talk about the who, what, when, where, why, and how of Innovative Medical and how it can help you and your family improve your overall quality of life. That is what we call our mission statement, and we're here today to kind of fulfill that for you. And as always, the number in the studio is 855-839-1210, 855-839-1210 at any time during the course of the program. If you have a question or you have a medical challenge that you want to run by Dr. Molly, well, that's what you do. You pick up the phone and call 855-839-1210. I've got half my Christmas shopping done, so I just wanted to
well, you know what, John? I have to laugh because, I have to tell you, I took a beating from our patients last week because you and I were off. Okay.
Yeah, right.
And
we're not allowed to take off.
No. And it was like, hey, is everybody all right? What was going on? I said, well, it was Thanksgiving, guys, and I really thought all you folks would be out, shopping on the day we were on. And we just took a little break for one day. But we're back, and we're going to work right through till the Christmas holiday, but I think we're entitled to that.
Yeah,
don't
absolutely,
you think, John?
absolutely.
Okay.
We can't have a day off.
Well, no, you know how it is. Hey, John, a day without you in the office on Tuesdays and Thursdays is like a day without sunshine. Everybody wants the John DeMasi, and I'm thrilled that you're our patient, John.
I came in late on Thursday.
I know.
And everybody said,
where's John? What's the matter? I said, everything is cool, man. He does have a business to run, and he is out there. He's doing his celebrity hosts, I said. Come on. Anyway.
Well, let's talk about Innovative Medical and what is different about you and about your clinic and about, just in general, what is different about it?
Well, look, let's start with the fact that we are a group of like-minded healthcare professional providers who are all working out of my licensed primary care facility in Marlton. And in doing that, we're able to do anything that your primary care physician would do. If you need a prescription, we can write a prescription. If you need some radiology, let's say you have a problem and you need an ultrasound, that kind of thing, of course it can be done. But in addition to that, we like to utilize natural substances to help a patient in their healthcare journey. In other words, let's say you have a problem with cholesterol and you're on a statin drug. Well, we're not against you being on a statin drug, but we'd like you to use the least amount of that statin to do the job and augment that with some natural substances like things like red yeast rice, that kind of thing. So really, we do this, though, many times with hydration being the vehicle by which we're able to deliver the natural substances. And why hydration, John? That's easy. It's a more direct way to actually effectuate the change, have the patient improve their quality of life much quicker without other side effects.
Talk about your protocols. They're proprietary, of course.
Of course.
But it's like that's your way of getting a lot of things in there that can help people.
Correct. Synergies.
Right.
That's what I like to talk about. Synergy.
And so what works with what.
Correct.
And what doesn't work with what.
Right. And I think it's really, really important. And that's the beauty of a medical facility that does hydration. The reason why I say that, and not one that just has the medical director up there because you have to, by law, have the medical director, but one whose medical directors are involved with the clinical with the clinical chemist or whomever is doing this, or the nursing staff, to say, okay, this sounds good, Dr. Molly. Let's try it, and let's, of course, try the research and development on this, and let's look it up. Well, I'm a big one for that as a scientist, Thing about this, John, what separates us is we are science motivated. In other words, we're a medical facility, so therefore we have patients. At least my doctors, my nurses have patients. But I look at the science behind how we do this hydration, and I do believe that's what really has separated us from the pack who's now doing this kind of thing.
So you believe in the science, and
Yes.
you follow that.
I follow the science.
And other facilities follow.
They follow a set standard protocol that's been around for the last probably 50 years, if you look at it. But the bottom line is there's so many things. We all know, we all start talking about the 21st century medicine. I was out with a group of physicians this week. And I'm sitting there, were 7 of us. And there were surgeons, a chiropractor who was there, who actually was on a like-minded as I was, and someone who was doing orthopedics, and another physician that was in primary care. And it was interesting because I saw the real difference between science and medicine at that table. In other words, medicine goes along with what the protocols are as they are. This is what we can do for a patient in this condition. It's very difficult sometimes to get physicians to really think out of the box. I'm lucky. I have 2 physicians right now who all think out of the box. And that's really important because it helps move along our protocols in such a way that we're able to help people using this hydration and the synergies that we have put together, meaning myself. And I'll tell you, proof is in the pudding.
Well, you think out of the box.
No question.
And you also think within the box.
Oh, yeah.
So you cover both bases.
We really try.
And that's really what separates you from others.
Well, I think so. I think that and also I think the absolute staff that I have, we are all caring people. We like to be involved with our patients.
Yes.
We want to know. You have an appointment up there with your oncologist next week. I know who you are. I want to follow up with that. I just don't want you to sit in my chair and get vitamin C. That's not enough for me.
Yeah.
I want to know what are the latest results. And how are you feeling with this? And is there some area that we need to reconcentrate our efforts on to really improve your quality of life?
And that's been your theme all along for 26 years. 26 years. You've been doing this for 26 years.
Yeah, but I'm not stale. I want to put that out. Yeah. Come on. Somebody said, well, that's old head thinking. I said, no. I look at the research that's being developed right now in terms of things like the regenerative medicine, use of MSC cells. I really believe we're on the forefront. We were doing 21st century medicine in the 20s.
Before.
That's right.
I mean, you've been doing it. Just because you've been doing it a long time doesn't mean you're doing the same thing.
That's exactly right.
Because I know that you've evolved over the years.
Absolutely.
Because I've been with you 20 years.
I know.
So
and
it's
you look
like
damn good.
That's right.
I can't say that on the radio.
But what people they can expect what in like their initial consultation?
Well, I think it's really important that people come in for the free consultation. I try to give people 15 minutes. Generally, that doesn't work out.
That's never happened.
And what happens then, I get a feel for what it is the patient wants to accomplish and maybe what their challenges are. And sometimes they come in with their blood work. Sometimes they've been referred by other physicians. Sometimes they've heard us, thank goodness, on the radio, and they have some real challenges, but they have an understanding of their condition, and they have some goals that they want to meet. Well, that gives me an opportunity to say, well, I think we can happily make you part of our clinic family, and this is what we need to do to make that happen. And, John, that consultation really gives us the beginning of how can we help you individually and not what we do for everybody else. Everybody is an individual patient at our facility.
We are coming up on our first break of the morning. The show is called Health Watch. And every Sunday we're here from 8 until 9 here on Talk Radio 1210, WPHT. I'm John DeMasi with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. We have a lot more show for you. And 855-839-1210 is our number. And we always tell you, call early because we want to make sure we can get your call in. And it happens every week that we get a call at 2 minutes to 9, which we really can't do anything for you at that time. So call in 855-839-1210, 855-839-1210. We have more Health Watch right after these words. We are back here on Health Watch. Operators are standing by right now at 856-489-0505. That is the number for Innovative Medical Associates, and you can call now or you can call anytime. Call during the week, 856-489-0505, but you should call to set up that initial consultation with Dr. Molly, and of course that is complimentary. 856-489-0505. And I want to mention, I started the show by saying I got my Christmas shopping half done. Well, if you want to get it all done for someone who's really hard to buy for, what you do is you get them Dr. Molly's line of skincare products, and you'll check the website out, innovativemedicalassociates.com, and you can see all of the products on there. And I can tell you, I use them myself.
I know you do.
I use them myself, so
Cool.
it's really a very, very good gift and something that they don't have. So check it out, innovativemedicalassociates.com, Dr. Molly's line of skincare products. And we are on Health Watch every Sunday, 8 till 9 here on Talk Radio 1210, WPHT. The number here in the studio, 855-839-1210. That's 855-839-1210. This patient that you're going to talk about, this is pretty serious.
Brand new patient. She came in for the consultation.
Yeah,
and she's starting this week.
Yeah, it goes to show what you're doing as opposed to what others are doing, because she came to you. She had been to another facility.
Correct.
And it was night and day, according to her.
It was interesting. She was actually referred to me from an orthopedic surgeon who said, listen, I don't know where you're going right now, but you really ought to call Innovative and speak to Dr. Molly. And she said and I actually saw this surgeon on Wednesday night this week, and she said, how is she doing? I said, well, she's starting this week coming up, and the surgeon said, I'm really glad she's seeing you because she was such a heartbreaking situation because she has an obscure lung cancer, very obscure. And it's not something that they usually see. It's like, we usually see certain types of cancers. And not only is she being treated and has gone through various treatments, I'm saying traditional treatments, and they haven't worked for her. She has pretty much been, I would say emotionally, given up on the supportive care because she went to a place where she was getting some vitamin C, but she said it was like hit or miss. They couldn't tell her. They were starting at a lower dose of the vitamin C, and they didn't have the facilities to really keep her safe while she was getting this. And so she took the doc's advice, and she called me. She came in for the free consult. And I have to tell you, my staff did an excellent job because once I heard this case was going to be a difficult case in our delivery, because we have to be extremely careful with some patients. Again, it's an individualized treatment. But I went on to say, aren't they giving you anything else besides the vitamin C therapy? No. I said, really? I said, someone like you with any type of these things need more anti-inflammatories. Maybe they wouldn't give it to you on the same day, but I'm sure they would. No, they didn't have it. They didn't have the anti-inflammatories, things like curcumin, boswellia, which is frankincense right now,
right,
and maybe quercetin. So these are the things. And again, I have all of these made under spec for us, and I can tell you that I think her outcome in terms of her quality of life is going to be better, John.
So they weren't giving her
they weren't giving
necessary things that.
Well, they weren't giving her an individualized protocol. When I reviewed her records, I saw all of the ugliness of the inflammation in terms of certain other autoimmune cells. And I said, this girl needs to be boosted, we can't just concentrate on vitamin C therapy. Of course, that might mean she has to come in an extra day or so a week, but that wasn't her issue. Her issue was she would do anything the other facility told her to do, but they didn't even offer it as an option.
She was in stage 4, is that correct?
She is in stage 4. And so she has a wonderful partner who comes in with her, and we're going to treat them as if it were one of us, and that's the difference. And I do that for all of our patients, not just cancer patients, any patients. But this particular case really resonated with me because she's young. She's only in her 60s. She was a pretty heavy-duty worker type person. She never took any time off. I mean, she really is a great case. But again, it has to be an individualized case of utilizing things, not just the vitamin C, but the vitamin C with several other things in order to effectuate the change. She needs to get a little more strength. I mean, you can imagine what this is like. She said she still has some things to accomplish in this world.
Isn't that something? Yeah.
And that's what I
Yeah.
want to do. So she's just one of many of my cancer patients.
Talk about the difference between you and the spa-like settings that it seems that a lot of them have.
Oh, they have vitamin C.
What's the difference?
But one of the things I want to say is that what are the sources of vitamin C? Where are your sources? I mean, there's manufactured vitamin C. These were the questions I asked her, and then I got the records and I realized. So, yeah, we have sources of vitamin C. It can be a tapioca source. It can be a beet source. It can be some other source. What you want to do is you want to utilize the appropriate vitamin C extract for a particular patient's problem. For example, you don't want to use corn. It has a lot of vitamin C in it, but you don't want to use it because it also has a lot of sugar.
Yes.
Right? So what do you want to do? You don't want to, there's a school of thought of which we subscribe to, meaning places like us, integrated facilities, where we believe sugar feeds cancer. Now, you can go into the conventional oncology unit and have a big bowl of hard candy there, but, we know that it feeds cancer. So bottom line is I'm going to use certain nutraceuticals that we believe are more appropriate.
So when you're getting this kind of treatment, you really have to get other things besides vitamin C.
Generally, what it is, I don't like when people come in and say, I just want vitamin C. Okay, we can do that. And I will fulfill what you want. You're the client, so to speak,
yes.
Right? Okay. But I like to sit down and educate you on why you might want to look at possibly taking some other types of anti-inflammatories, and maybe you might want to take some things that help improve liver function while going through the chemo. So, or the radiation. You may want to look at some of nutraceuticals that can help you get through your radiation as well. So I like to educate as well as say, okay, let's be arbitrary and just give vitamin C.
And so it's not just vitamin C.
That's
what
but we
this
do
theme
do
is
it.
here.
I mean,
Yeah.
we do. And listen, vitamin C is your favorite thing in the whole world. So
I swear by it.
I know you do, and I do too. And I'm not saying let's do appropriate dosing of vitamin C, appropriate extracts of vitamin C. Let's look at what can synergistically go with the C possibly to help you in the other areas that you need. I think we forget that people who are going through cancer have dysregulation in various systems, not just the system that has the cancer. The thing about cancer is you don't get diagnosed with it on Tuesday and you just got it on Wednesday. It doesn't work like that. It takes years, right? So something has been dysregulated that whole time. And when we look at a cancer patient, or when we look at any patient, I'm looking at what has contributed to their challenges that have actually have started them down a road where they're not having the quality of life that they could have. When did that start? And what has contributed to that? Is it diet? Is it lifestyle? Is it environmental? I mean, there are so many things, John, and those are the things we need to look at when we look at every patient.
Well, for example, when I had my stroke,
Right.
you said to me, well, have you been checking your sugar? No.
No.
I
But you've been
didn't-
telling Barbara that you have.
Yeah,
So it's like,
two,
oh, yeah, it's
2
good.
years I didn't check my sugar.
I know.
So,
Well,
and
hello.
that was contributing to
Absolutely, because again, the molecule is so large. Can you imagine your blood pumping that? Look at your pinky as your cells, and the sugar molecules like your thumb. Hello,
Yeah.
there it is, babe. You know, you got it. We've got to look at all of these things. So lifestyle is important, and we want to know these things. Look, we're not the food police. We don't say don't have a glass of wine. You know, I have a very large Italian population, right?
Yes.
They like their homemade wine,
Right.
okay? And we say that it's a lot of good out of one glass of wine. But the point is, don't drink a bottle.
Yeah. So then it's really important to follow
Right.
a proper diet.
And it's important that we incorporate what we do into your life. In other words, look, you're going to improve your quality of life just by coming in once a week and sitting in my chair if you don't change anything.
Right.
It is true.
That's true.
I see it. But boy, if you change a few things, if you listen to what we tell you to get in terms of the oral, by the way, we don't push oral supplements. You know that.
Yes.
I have a very limited stock, stuff that we know that people need right away, and a limited stock of tinctures, that kind of thing, for people that are homeopathic. I understand them, but here's the deal. We can send you to a place and let you buy them off the shelf, maybe a little cheaper than we could even get them. So we're about your entire quality of life, not just sit in the chair and, you know, it's going to be holy water.
And we should also mention that you do consult with people
Oh, my
as
goodness.
to what the supplements they should take on.
Absolutely. Listen, we know these products in and out, and I will tell you that as a result, our patients tend to do better. And I know I don't want supplement companies to beat me up because I know that there's a lot of good ones out there, and why not utilize them? But the idea is, why not use an appropriate supplement? And you're never going to get as much out of that pill bottle as you will with the IV.
As you've always said, when you take 1,000 milligrams of vitamin C, that's a drop in the ocean.
compared-
And the whole ocean is your hydration.
Exactly right. Exactly right.
We are coming up on the halfway point of the show, which means we still have plenty of time to take your calls at 855-839-1210, 855-839-1210. Our show is Health Watch, and you'll find us here every Sunday. The morning version, 8 until 9, right here on Talk Radio 1210, WPHT. I'm John DeMasi with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, our number here in the studio, 855-839-1210. We will come back with plenty more of today's Health Watch after these words. We are back here on Health Watch, and as always, operators are standing by right now at Innovative Medical Associates, and the number 856-489-0505. 856-489-0505. Call and set up your initial consultation with Dr. Molly. It is free, and you will really learn a lot, and you'll probably learn a lot about your condition as well. So just call her, 856-489-0505. And remember, a lot of good information on the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Check that out as well. And check out the Dr. Molly line of skincare products. Perfect gift for the holidays. What else could you ask for? It's Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210, WPHT. Let's go to the phones. Linda is in Medford. Linda, you're on Health Watch with Dr. Molly.
Hi, Linda.
Hi, John. Hi, Dr. Molly. Yes, hi. I am having a situation. I have a lot of hair on my head. It's very thick and long, and everybody always compliments me on my hair. However, I'm losing my hair. And it's just, I can just be walking and strands of hair will just fall. It's
Wow.
unbelievable. And the other thing that's happening that's concerning is that I'm getting hair growth on my chin and my upper lip. And, and I know that can happen as you get older, and other areas
How
of my
old
body,
are you,
it's
Linda?
just-
How old are you?
I'm
Linda?
72. 72.
Okay. All right. All right. So have you spoken to your primary care doctor about this?
It's not actually primary care, but yes, and I have. Excuse me. I was given estrogen.
Mm-hmm. That's what I'm asking. Exactly what I'm asking. Good.
Okay.
Good.
And I was, and I'm also taking Lugol's. Not necessarily for that, but
right.
Anyway, but this estrogen, and I'm really good about following procedures, but it seems like it. I don't know. It seems like it gives me heartburn, and I don't know, but I haven't. It doesn't. I don't know. I was taking it. Doesn't seem like it's really working, and I went online and looked, and maybe I need to be doing some other things with this or whatever. But it seems it's getting worse. This thing with my hair, it's getting worse.
I believe you. Can I ask another question? Because this is important information. The estrogen was prescribed by a GYN doc or, again, by an integrative doc? Was it prescribed by an integrative doc? So it's bioidentical estrogen, right?
It's orthomolecular product. It's by orthomolecular product.
Okay.
And it's got vitamin. I do take vitamin E, a lot of it, but it's got vitamin E, 33.5 milligrams, and it's got indole. You probably know what's in it. Okay.
Indole. Yeah. Listen, that product. When you talk about it, it's actually a. I think it's a plant. It's a plant source estrogen that hasn't been bioengineered to your cellular. In other words, when I talk about bioengineered hormones, I'm talking about natural, quote unquote, natural hormones. That is a plant extract, and I'd like you to think about that for a minute. It doesn't have a catalyst, so it really isn't large enough to fill your estrogen receptors. Do you see what I'm saying? In other words,
to lower them, then yes.
Yeah. Here's the thing. You may need even though you're 72. You sound like you're very vital. You're a young woman, and I'm older than you, by the way. I want to say that. Okay.
Oh my goodness.
All right, honey. I'm older than you, and I'm saying you're a vital woman. You may need some other types of testing that I would want to do from our facility, and I'm talking about stuff that is traditional testing, meaning like from LabCorp, Quest, these kinds of places. And I may want to look at some other things, like some of your particular white cells in particular, and I want to see if possibly you're developing an autoimmune response to something. Believe it or not.
That's what I'm concerned about. Yeah, because I looked up that herotism, or however you say that.
Yes.
And
you're right. And I want you to realize, don't beat yourself up. You're absolutely right to go down that track, because it's not really natural for you to be having this problem at 70, and it's certainly for someone who's taken as good care of themselves as you have, because I can tell you have. So the bottom line is, I'm going to go down the rabbit hole a little more, because I think you have something else going on, another underlying condition. So
that's what I'm concerned about.
Yeah, well, I'm in Marlton. Come on down. Call for a free consult. Will you? You sound like a really lovely lady, and I think we'll be able to help you, okay? And bring all the vitamins you're taking, too. That's the other thing. Listen to me, because sometimes they're counterproductive to each other, all right?
Yes.
All right, honey. Thank you.
Thanks for the call.
Thank you. That's a great call, Linda.
Yes.
Thank you.
855-839-1210. Boy, there's a lot in that.
Yeah, I know. That's why, do you notice I can't really get into every single thing, but I was asking poignant questions because it just didn't make sense to me about the estrogen business. So what she has is something that has a component in it that should be helping her. But again, it may not be. And the other thing is, when people look at bioidentical or hormone replacement, they really should be looking at that in total, not just saying, oh, well, here, take this supplement and it's going to help. I really think sometimes the supplements, if they're not used properly, and again, I'm 100% for supplements, that's natural products, but you want to use them properly. And remember, things that screw around with our hormones, John, have to be like Goldilocks, just right.
That's right.
Okay, so that's where I'm going with that.
All right, 855-839-1210 is our number here in the studio. Will we ever get rid of COVID?
No. The answer to that, and there is, the joke that's going around, so we don't have to say it, but the bottom line is no, we're not going to get rid of COVID, at least not for another 2 years.
Yeah.
Right? That's what people were saying in our office.
Yeah.
But the bottom line is the long haul issues are tremendous. And people are really going out on disability over it, John. I've been seeing patients left and right have come in for consults who are coming in and are out on disability because they can't breathe. They're still having the fatigue. That's a monumental problem. I will tell you that our long haul protocol, I believe, is working very well. And we're utilizing natural substances both with the hydration and also with inhalation. So, people who have puffers know what that is. You have a puffer and you're breathing it in and it goes directly to the lungs. So we have a protocol that incorporates both hydration therapy and also the use of a nebulizer. Now, again, this is what separates us from a spa. I would not suggest you go into a spa and do a nebulizer. You want to be in a medical facility that has crash carts. Not that it's dangerous, but you want to make sure you have everything on hand in case a patient feels like they may pass out or whatever. Bottom line is I have the nursing staff for that. I have the nursing assistant staff for this. We are fully functional and you're in good hands. So I'm able then to enhance a post-COVID protocol is what I'm saying. And we do.
You want to have a facility that's equipped
exactly
to handle anything.
Exactly. And when you're really in trouble, we're right down the street from Virtua.
Okay. What about the post-COVID patient? And you said all the vitamin D levels were down.
Oh, yeah, this has been pretty interesting. I've been collecting on all our post-COVID patients. I have been collecting their blood work, and I've been sort of matrixing their vitamin D levels. And interestingly enough, even though pre-COVID, if they were patients of mine, I was lucky enough to have their pre-COVID testing, they had an adequate vitamin D level when, unfortunately, the standard in my mind is not adequate, but at least they had an adequate. Following COVID, following this virus, they tend to have very low levels of vitamin D, which tells you how important vitamin D is in really enhancing your immune system. So again, in all of our long haul protocol, we include vitamin D. Generally, we use it in an olive oil type thing or cottonseed to make sure that the body can absorb it more readily. But this is very, very important that people maintain their vitamin D level after the COVID and actually, God forbid, before COVID.
Why is vitamin D important?
Vitamin D is a cofactor in many of the intrinsic types of protocol that the body uses internally to help our white cells utilize the white cells that go in and really clean up the viruses and the post-virus. So it's very important.
Yeah,
it is an
that's
absolute...
my point,
yeah, and vitamin D, as you know, is part and parcel of many of our protocols.
And what other things
Oh,
do
my
you
goodness.
use?
Vitamin C, and again, quercetin again. And, of course, some of the anti-inflammatories like curcumin and turmeric. Also, I would tell you NAC, which is also an important nutraceutical. And there are just so many ways to utilize these nutraceuticals, and that's really the key. And which one do you use together? Which ones do we string out a little bit and use during the protocol that we're using for a patient? Most of our patients tend to do better in 5 treatments with post-COVID, which is pretty quick.
And that brings up a question that I should have asked you earlier, and I guess it's different with everybody, but how many treatments?
Depends. When you have cancer, I affectionately say you're probably going to be a lifer with me, not necessarily at the frequency that you do right now. But interesting, I have a patient right now who had extreme depression, who's taking the antidepressant. She's seen me every day last week. She saw me, and she's going to see me every day this week because we're using a particular substance that improves nitrous oxide to her brain, and we're utilizing it in a way that can work coefficiently with her antidepressant. And I think we're going to help her anxiety and her depression. But again, this is the kind of case where it was pretty severe. And what's interesting is she's had this depression since she was pregnant, postpartum depression, which was years ago, and didn't even address it then. So until it got worse.
Wow.
That's bad.
And you'll keep us posted on that.
Oh, yeah, this case is very interesting, very interesting.
Okay, we're coming up on our final break of the morning. It is Health Watch every Sunday, 8 till 9 here, the live version on Talk Radio 1210 WPHT. I'm John DeMasi with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. If you want to, we still have time, 855-839-1210. If you want to run by a medical challenge that you have, or you simply have a question for Dr. Molly, 855-839-1210. We will come back with more of today's Health Watch after these words. We are back here on Health Watch, and as always, operators stand by at Innovative Medical Associates, 856-489-0505. That number again, 856-489-0505. Call and schedule that initial consultation with Dr. Molly Fantasia, and that's where you'll really find out how, or if she can help you. It's free, it's complimentary, so take advantage of it. 856-489-0505, and check out the web. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. Check that out as well. Health Watch is the program, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Let's go to one of our favorite callers, Frank in the Northeast. Frank, you're on with Dr. Molly.
Hey, Frank, it's good to hear from you. It's good to hear from you. You're feeling better, my friend, I hope.
Well, actually, I got sick last week. I got a sore throat. I was so bad on Wednesday and Thursday, still recuperating. First time sick in like 25 years.
Are you out of the
No, not yet. Thursday I'm being discharged.
Hey, listen, Frank. Now listen. Underneath all this, you're still a nurse, right? You remember that. So you know why
it's been a long time since I practiced.
I don't care. You know the fundamentals. It never leaves you. Come on, and you know why you got sick in there. Go ahead. Okay.
Dr. Molly,
yeah.
I got a funny tidbit. Last Sunday, I was not not expecting a live episode, but I was pleasantly surprised because it was a repeat episode featuring yours truly when I called in.
Yes, I'm glad. I'm glad.
That's the one John said, he doesn't sound good.
Yeah, that's right. That's right.
I never made a repeat before.
Oh, well, there you go. And
whoever picked it, thank him.
Go ahead.
Yeah.
No,
well, we like you. We like you, Frank. So there's no problem.
You
know,
My
we
favorite
really do.
duo.
Yeah, you're the best.
Thanks again. Have a good weekend.
Well,
You too.
Hey,
You too. Get well
Frank,
soon.
Get well. Get the heck out of there so you don't have any other problems, okay? You know that. God bless.
Thanks for the call, Frank.
God bless.
855-839-1210.
That's funny. That's a funny story.
Actually, I picked the show,
Yeah,
not knowing that he was.
That's okay. That's all right. But you know what? He's okay. And the thing about Frank is he has a real talk about genes. He got some bad genes here.
Yes.
But that may be a good thing for us to talk about because genes can be turned on and off by many things, right? By things like environmental issues, things like being on medication can turn off some genes, which is why statins were used initially. But they can also be turned off by nutraceuticals. So if that's the case, do you think genes could be turned off by good diet? The answer is yes. Sometimes a good diet is all you need, but many, many times you need to get the extracts of what you would be taking in that good diet in your meal. And so we would do that through the hydration, and that could effectuate the change you need to sort of get you off the medication.
And therein lies the value of hydration.
Exactly.
Because most people wouldn't know what you just explained. They wouldn't know that. Well, that's why they come to you. Because
Right. And the thing is, John, just because mom and dad died or had heart attacks, this kind of thing, doesn't mean you have to have it. We know that epigenetics, the outside forces that can contribute to this can change your life. And the bottom line, that is true almost with every chronic condition, including things like the pain from your joints, from arthritis, these kinds of things. How many times do I have patients who come in with severe arthritis when we change them up a little bit and make them aware of anti-inflammatory foods and cutting down on some of the carbs and putting in things like the boswellia I spoke about in the last segment, which is frankincense, and using ginger, etc. How many times have we improved them so much that maybe they get off their biologic? Okay.
Yeah.
That's the key. So these are the things that I like to do. I mean, which is why I don't believe we are a spa in any way, shape, and form, except that we care for people in a way that is a very caring facility. So it's not like walking into a sterile facility, meaning, quote unquote, in terms of the ambiance, but in terms of that it is absolutely, quote unquote, sterile in terms of the medicine. Absolutely.
Well, you are a spa because you give facials.
No, that's Ellie. Good old Ellie. Yeah.
Ellie gives
you know what?
excellent facials.
Well, we really just do that to help actually our own patients. We're not really going out and looking for that.
I know
this
that.
is for our own patients just to feel a little better, especially people with chronic conditions. And interesting, she uses the natural products that we have put together.
Yes.
And that's very important because what we put on the skin can be absorbed. So I don't want my cancer patients to absorb any of the fillers, et cetera, in some of the stuff you get in spas. Okay?
Yes.
So there it is.
Yeah, right. But we should mention also, and it's a good segue into the skincare products. You have a complete line of
Thanks
skincare
to
products.
the help of Dr. Harvey Glass. Right.
So,
he was a great guy.
and they're available now, and you just go on the website. And, you know, it's a great gift, by the way. It really is a great gift, Dr. Molly Skincare Products. Real quick, we got a couple of minutes left, and you wanted to talk about getting off your meds.
Right. Yeah.
And a lot of people this time of year say, you know, I'll take it back up after the holidays.
No, I don't want people to do that. I want them to be careful about your meds. Listen, folks, you hear me talk all the time about Goldilocks because not too much, not too little, just right. When a physician puts you on the meds, you really need to take it. If you're having side effects, etc., you need to figure out, why am I having these side effects? Is it from the condition or is it from the med? If it's from the meds, we can help you get off of those in a way that's strategic. We don't want you to throw your meds away. I mean, this is the kind of thing where my docs get involved and we say, okay, we may be able to cut down on some of the meds by utilizing some of the natural products I was talking about earlier. But we want to do that carefully. But, you know, it's an amazing thing. Like I said, I've seen people be able to get off their meds by utilizing the hydration therapy, and their own physicians will take them off after they go back to them.
But there's a system there.
Right. You don't just stop.
Don't just stop
because
it.
you can get rebound on many of these meds, which means you'll be feeling worse. And the one thing Dr. Molly doesn't want you to do is put yourself in jeopardy. We won't put you in jeopardy. I don't want you to put yourself in jeopardy. And believe me, I have a lot of hotshot patients who said, I'm just stopping this. I say, no, don't. Please, let's call your doc. I'm sure you'll work with it. Nah, I'm just stopping. Well, thank God we haven't had any real problems, but I will tell you, that's not the philosophy of our facility.
And with that, we wrap up another edition of Health Watch. Don't forget, Dr. Molly is available during the week, 856-489-0505, 856-489-0505. And if you missed any of today's show, you can catch us this afternoon, Health Watch replay, 4 until 5 this afternoon, right here on Talk Radio 1210 WPH.D. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff, Barbara, Lana, and Catherine, and of course, there's Joanne, fabulous Fran, delightful Dee, and our medical assistant, Karen Kathy. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week. We will do it all over again next Sunday. Health Watch on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.